We will discuss that of what publicly known as of the mid-2025 about the Johnny Depp's health, his past struggles and the recent developments. What is confirmed, what is speculative. If you want, I can also outline that what might become the concerns medically speaking based on what's the public. What is known and confirmed. Depp has been open about a long history of the alcohol and the drug use in the legal proceedings, especially during the 2020 UK trial involving the son. He revealed that the suffering from the chronic substances abuse disorders, nicotine addiction, depression, and what was called the primary dopamine imbalance. These disclosures show that what the substance use, mood, depression issues, as well as the neurochemical imbalances even have been a part of the health story. Ankle injury in the 2023, Depp fractured his ankle began as a hairline break sometimes between the Cannes Festival and the performances at the Royal Albert Hall, which got the worst. Doctor advised him to avoid the travel and the activity, and he had to cancel the concert appearances with his band Hollywood Vampires. More recently, sources say that the Depp has been making the efforts towards the cleaner living. His physical appearances has shown changes, weight loss, and when he appeared in the UK premiere of the Janu Dewberry, people noted that he looked cleaner, more polished, and healthier. A source said that he is prioritizing his health and well-being more and much more than these days. About the dental health of the Johnny Depp, we can say that there have been reports that Depp underwent the corrective dental surgery or the producers because of the poor dental health. Rumors suggest that his teeth were deteriorated and rotten, and that they was at some risk for the related health issues like the infection, perhaps the more serious. The source claims that these issues have been addressed. After his defamation trial with the Amber Heard, reports suggest that the Depp is now in the new chapter with somewhat more stability, fewer public legal battles, more focus on the creative outlets like music, art, directing. These are the reports that he have feeling better, healthier in the mind and the body. What is less certain and the speculative. There are also a number of the claims, concerns, or the observations which are not confirmed or are coming from the anonymous sources or the tabloids. So should be treated and with the caution. Some reports, often in the tabloid style outlets, claim that the Depp has lost the larger amount of the weight loss, looks the gaunt, frail, and possibly in the poor health. However, these reports are not well substantiated, that they come from the sources that they are not always reliable. It is not clear whether they are due to the role photos, lightning, or the actual illness. Because of his past heavy alcohol and the substance use, there is a speculation from the media that Depp might have been at a risk of the liver problems. But there is no credible medical source confirming that he currently has a liver disease, so this remains the speculative. Some poor reports imply that they have the dental issue. He have the dental issue. They were so served that they could be led to or already had led to synthetic issues, inflammation, infection, and the heart diseases risk. While the dental health can impact the overall health, the extent of those reports in his case lacks the medical verification. Observers, fans, paparazzi have noted that sometimes looks pale, thin, possibly under the stress. But external appearances is not sufficient to diagnose illness. There is no solid public record of the serious ongoing medical illness. Besides the fractured ankle that is confirmed, some mystery illness reports are likely the rumors. Putting together that there are more credible, it means that Depp is making the genuine effort in the recent years focus on the wellness, reducing or managing the previous substances issue, improving the appearances, diet, lifestyle, taking time off when he needed, i.e. for the healing or the rest. The ankle injury in 2023 was significant is in the sense of if they force the cancellations and the limitations. Presumably, he has been recovering since, though the chronic joint issues or the after effects are always possible, depending on the nature of break. Dental issues were probably more serious than the casual rumors suggested. Oral health is something that he has seems to have addressed. Mental health remains an area likely still relevant. Depression, adaptation from the past to trauma, stress from the legal and the public scrutiny, but there is no public evidence of any new major diagnosis in that regard. Given his history and what is visible publicly, there are some health risks or the unknown one might reasonably be concerned about. The Though to be clear, these are the confirmed that given past history and the stress of the touring, public life might pose risk if it is not managed. About the alcohol substances like and the liver kidney health. About the long term heavily drinking and possibly chronic the medication use could implicate the liver. Also the dental infection can stress the systematic health. About the mental health, the depression, anxiety, stress, possibly the PTSD from his public legal battles, physical issues etc, dental or the oral health, even if it is repaired, the past neglect can have lasting the implications, gum diseases, root problems etc. Injury or the physical strain on the touring, performing, travel etc. can tax the body. Past injuries, ankle, and may leave the lingering effects like pain, mobility issues. What would help to know the missing info? To understand fully his health condition, one would need the medical reports or the statement from the Johnny himself or his doctors, which are generally private. Clear clinic assessment, for example, the blood test or the liver infection imagining to confirm or rule out the organ damage. Information about the current medication, therapy, or the support systems for the mental health. Details on his lifestyle, diet, exercise, stress, sleep, and how he handles the stress. Whether he is maintaining or he has quite any ongoing substance use or in the recovery beyond what is already known. Guys, if you find this video as entertaining and interesting and you find this video as informative, then you have to like the video and also have to subscribe the channel. I wish you very best of luck.